Welcome all of you to today's discussion. Before going to the session, I would like to thank Father Saleen Joseph for immense support and the guidance throughout my journey. And thank you all admin panel members, especially for Arya and Sunil Chechi for your support. So today we are going to practice about reading part A. This is the latest test from the OET official site. Thank you OET for allowing us to take this sample material for teaching purpose. OET 2.4 reading part A. As we know, the reading part A has 4 texts. That one, text A, B, C, and D. So we have to identify. We know about the sequence of the each text. So there are 20 questions in reading part A. Minimum we have to get 18 out of 20. Then only we can crack our desired score. Then here, the greatest challenge or enemy is time. Only 15 minutes for the 20 questions. At the first, maybe it's hard to finish within 15 minutes. So by practice, we can achieve by 15 minutes. So what you have to do, you have to do the continuous practice with the patient. Then or fast reading task. So this is also most important. So what is the expected grade or band? Here, the A grade is 450 to 500 and the B score 350 to 440. So C plus D, we are not thinking about this one. In the Edu Skills, only we are aiming grade A. So your mind, you have to set it for the grade A. Because sometimes you are, yeah, B is enough for my desired score and I can go my dream country with a B grade. That's why you are going, your grade is going to down because you are practicing for only the B grade. So today itself, you have to change your mind and always you think, I want the A grade in all subtests. So think about only for the grade A. So well done. Grade A 450 to 500. So this is 18. We have to minimum 18 out of 20. So our greatest mistake targeting grade B. So psychological impact on mind and brain. That's I mentioned before. Always we are fixing for the grade B 343. Grade B. That's why it's going to 340 or below C, like that one. So always aim for grade A. Then reading part A 2.0. The time is 15 minutes. So here, the reading part A, copy and paste the exact answer what given on the text. And do not repeat unnecessary words or sentence. Do not stuck on one question. So this one is, if you didn't get one answer, skip that one and move forward. At the end, you can come back. So you can save the time. And by the time at the end, already you read the passages. So it's easy to find out the answer. Then no spelling mistakes accepted on reading. Finish within, so try to, by practice, try to finish within 10 minutes, maximum 12 minutes only. So what is the benefit for this one? If you finish within 12 minutes, there is a 3 minutes for rechecking. Or if you didn't get any answer, during this time, you can go to write that answer, and if there is any spelling mistakes or you write the answer it's incorrectly or repeat the words, whatever it is, you can correct it. So otherwise, it may affect to your score. So that's important, and recheck the answer again. So today's topic is about cellulitis. This is the 5th sample test from the OET official site. So here, tip 1, begin with a skim. So in this text, there is a first 1 to 8 question is asking about the which test. So in this case, we have to familiarize with the sequence of the each text. Here in the cellulitis, the text A is saying about the definition and etiology, and text B, severity of cellulitis, and text C, drug therapy, which is typical and atypical, and the text D, management locally affected area. Tip 2, focus on each text. Then the tip 3, skim which is search for the clues, the title. And if there is no title on any test, what you have to do? The topic sentence, the first sentence, you assume that one is the title of the text. Then the section heading, subheading, names, number, or percentage. So here, while we are speaking or saying anything, the percentage, if it's with a digit, it's percent, 90%, 70%. But if it's a percentage, it's a low percentage, high percentage. So always remember, it will help for your speaking. And sequential expression, time expression, scale, adjectives, and negative expressions. This all detail, Father has taken class and the video uploaded in our Edu Skills YouTube channel. So kindly watch the video, or those who watch the video also watch it repeatedly and make a note. It will help for your study. Then the 12 steps to crack reading part A within 10 minutes. The first one is identify 4 text headings and write down on a piece of paper. So that is this test. Cellulitis, the text A is about the definition and etiology. So we can imagine what are the things may include in the definition and etiology. The second one is the severity of cellulitis. And C, drug therapy. It's mainly about the typical and atypical cellulitis. The text D, management of locally affected area. Then understand the relationship and sequence among the 4 texts. Then skim the text and highlight the clues. So while you are doing the skimming and scan, what are the things is important, like title, session heading, subheading, name, number, percentage, sequential expressions, time expressions, scale, adjectives, negative expressions, like these important things, just underline. So when you are coming back to the test with the answer, when you read the question, then you are searching the answer option. So this highlight the words will help to find out the answer. Then read the question statement, highlight the urging words. What are the keywords there in the question word? Then read the question statement and match the text. Write down the urging words identified in the question. Arrange the urging words into 4 columns. Confirm answer 1 to 8. So begin with the first question onwards. Then locate the answer. Write the answer in the answer booklet. So in the OET exam, we have a question booklet and answer booklet. We have to write the answer, which is a copy and paste exactly what given on the text. In the question booklet, there is a space given to us. Proofreading and fill the self-assessment form. This you can find it from our Edu Skills platform. So you are doing practice each day. Fill the self-assessment form. Example, as we know, the 15 minutes for the reading part A. So while you are doing, if you finish only 15 questions within 15 minutes, so that will be your answer. So how many you got the correct answer? That will be your answer. So you write that one on the self-assessment form. Then you can continue the next questions also. Maybe it will last for 18 minutes or 20 minutes. It's not assess, only count with the 15 minutes question. Then identify 4 text heading and write it on a piece of paper. So this one, as I mentioned before, even on your exam day also, if you forget, you can write something on the side of the paper. So like a definition or something, so you will remember. Then understand the relationship and sequence among the 4 texts. So here, focus on the definition and etiology, severity of cellulitis, then the drug therapy, management of locally affected area. Then skim the text, highlight the clues. So while you are skimming, search for the title, and if there is no title, and read the first sentence, the topic sentence, you have to find out the title of the sentence. Then the section heading, maybe there is one text has 2 paragraphs. So maybe there is a one section heading, and maybe there is a 2 subheading. So you find out that one, and there is a name, number or percentage, sequential expression, time expression, scale, adjectives or negative expression. So now we are moving to the text A. First, read the title, section heading and subheading. I hope all of you have printed material. So you can take your printed material now. Then we will start to read the paragraph and identify the clues from the text. Are you ready?
Yes, ma'am. Yes.
So you can identify while I am telling. So the first one is cellulitis and definition. Cellulitis, the heading is a definition and etiology, and the text B about the severity, and text C drug therapy, and text D is management of locally affected. So now we will start to make. So the first you have to identify the cellulitis and definition, and here the first paragraph, it's a definition and there is signs and symptoms, and here is sometimes the time expression. Then the second paragraph is about the organisms. There are many organisms, no need to underline all the organisms. So as we know, this is the organism. Then there is something is given on the bracket. So we can mammalian bites, hot bites, salt water or fresh water. Then the third paragraph, it's about the commonly affected area, the leg is. Then the last paragraph here, recurrent cellulitis, and this is a scale more common. And here is disease condition, chronic lymphedema, and it's especially something other also. So we can mark that one. Then going to the text B. Text B is about the severity of cellulitis. So here the subheading, your own classification system can help to guide admission and treatment. So it's need to identify. Then there is a classes. Then the signs and symptoms. And here the class 2, it's some names of the diseases. And here comorbidity. Then the class 3, here also vascular compromise, and class 4 severe life threatening. Then here the next paragraph, cellulitis and hospitalized. Here time expression under 12 months and facial and immunosuppressed, name of the disease, and here common, scale, and deep here abbreviation DVT. Then the metastatic cancer. Then moving to the text C. Here is about the typical, the first part. Here all the medicine and the numbers given here, and there is something in the note also discussed with the local medical microbiology services. Then the next section heading is here, suitable drug therapy for atypical cellulitis. Then the text D, management of a locally affected, and section heading number, and here the number and the medication name. Here something avoid and monitor limb. So these are the skimming and scanning for the test. Now we are going to the question part. Compare the question statement with the answer statement in the text. So here is the text, the first 8 questions. This one need to answer A, B, C or D. So now you can start to answer. I will give only 2 minutes. If you didn't get any answer, you can skip that one. At the last, you can go for that the answer. Okay, are you ready to start? So you can answer the question. The first one is, while I am reading, you can answer your questions. Okay. Treatment for cellulitis caused by less common bacteria. Always remember the sequence of the 4 texts, and reason for drawing around the affected cellulitis, or system for determining where and how best to treat patients with cellulitis, symptoms that may be experienced before the infection is visible. 5th, for ensuring that patients' legs are more comfortable in bed. So here alternative medication for cellulitis, patients who cannot tolerate one type of antibiotics have to deal with the infection site after the swelling has begun to reduce, and who should be consulted regarding the pharmacotherapy for cellulitis. The first one, treatment, less common bacteria. The second one, reason for drawing around area affected. Third one, a system, how to treat patients with cellulitis for symptoms maybe before infection visible, for ensuring legs for more comfortable in bed, for alternative medication who cannot tolerate antibiotics. 7, how to deal infection site swelling has begun to reduce. And 8th one, who should consult a pharmacotherapy for cellulitis. I hope all of you have write the answer. So next we are moving to the question number 9 to 14, which is with a word or short phrase. So identify first, this one is under which text, then you can find the answer easily. So here, the which antibiotic formula is not suitable, the first one. 9th one. The 10th one is which pre-existing weight-related condition class 2 categorism. 11, what single dose benzyl penicillin class 4, and what may be impaired if anti-inflammatories AC inhibitor, and what is the single dose oral glucosamine recommended for the least serious category of cellulitis, and what is the maximum single dose of IV clindamycin recommended for a patient with class 4 cellulitis. So now you can start to write your answer. I'm counting the time here. I will give you 4 minutes maximum. Check the keyword, the 9th one. Antibiotic formulation is not suitable. So think about which text is saying about this one. And the 10th, pre-existing weight related. So when we mark the hedging weights, so we mark already this pre-existing weight related condition. And we know where is the class 2 categorism. 11, what is the single dose of benzyl penicillin in class 4? 12, what may be impaired if anti-inflammatories are given to patient who take AC inhibitor. So this AC inhibitors abbreviation, so we can find it easily this answer. 13, what is the single dose of oral glucosamine, then least serious category. So there is some synonyms used for the least serious category. That's we already marked that one. 14th, what is the maximum single dose of IV clindamycin for patient with a class 4 cellulitis? So this is some medication. First identify the text, so easily you can go there, and if you didn't get any answer, just keep that one, move forward and go back again. Think about as you are writing an exam, so what you will do on the exam day. If anyone finish this question, just chat in the chat box message. No need to unmute your audio. Yeah, someone is sending message to me. It's finished. So it's 3 minutes, only 12 seconds. So then, okay, we will move to the another one. Next category. So this is the question 15 to 20. The word or a short phrase, and do not say filling the blank. Do not repeat the word. So here also I'm giving for you the 4 minutes time. The first one, it may be necessary to carry out of dash blisters caused by cellulitis. 16, when prescribing anti-inflammatories, dash may be used as an alternative to ibuprofen. 17, a patient may have been exposed to infection by swimming in surface water or using. 18, a condition such as or even metastatic cancer may be mistaken for cellulitis. And 19, patients with exacerbating cellulitis, a compromised immune system, and those with dash should be hospitalized. And 20, patients suffering from can experience repeated episodes of cellulitis. So you can start now, and those who finish, just chat. The 15th one, here the keyword, it may be necessary. So the main model was necessary to carry out something blister. So here blister, which is caused by the cellulitis. So the next one, 16, when prescribing anti-inflammatory. So this is about the medication anti-inflammatory may be used as an alternative to ibuprofen. So this also we mark there. 17, a patient may have been exposed to infection swimming in a surface water or dash using. Then 18, conditions such as dash or even metastatic cancer may be mistaken for cellulitis. 19, patients with exacerbating cellulitis, a compromised immune system, and those with something that should be hospitalized. And 20, patients suffering from dash, the model web can experience repeated episodes of cellulitis. So some of these sentences are paraphrased in the text or some synonyms used. So identify the first, imagine the sequence of the text. The text A was definition, which is definition and etiology. And the text B was the severity. And there is one classification system. And text C, the drug therapy. There is 2 subheading, typical and atypical. And the 4th text was management of a locally affected area. So the locally affected management. So you can easily identify which text is that one. You can write it answer in your paper. So then later we will discuss the answer. Because this is official material. I know some of you have done already. So those who done, it's easy for them. But some of you didn't do the material. It's a little bit hard for them. So don't share the answer now. We will discuss the answer later. Now we are moving to the answer options. The text, the first one, treatment for cellulitis caused by less common bacteria. This is from which text?
CC.
And the second one, reason for drawing around the area affected by cellulitis.
D. That is D. Management.
Management. And the third one, a system for determining where and how best to treat patients with cellulitis.
That is for B. D. B. B.
Yeah.
B, no?
Yes.
B.
Then fourth one, symptoms that may be experienced before the infection is visible.
A.
A. Then fifth one, for ensuring that patients' legs are more comfortable in bed.
D.
Okay.
Management.
Yeah. Then sixth, alternative medication for cellulitis, patient who cannot tolerate one type of antibiotic.
C. C.
Okay. Seventh one, how to deal with infection site after the swelling has begun to reduce. If any answer is doubt, we will move to another one. Then later we will discuss about the answer.
D.
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 Then 8, who should be consulted regarding pharmacotherapy for cellulitis?
D.
C.
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 C. Oh, sorry. C.
So we will discuss this answer in later. So there is a confusion. The answer option is C.
C.
Then the next one, the 9th one, which antibiotic formulation is not suitable? It's from which text?
Topical antibiotics. D.
So in your answer option, how you to write topical antibiotic or topical?
Only topical. Only antibiotic is given there.
Yeah,
topical.
Then the next one, 10th, which pre-existing weight-related condition would prompt a class 2 categorism?
Morbid obesity.
Morbid obesity.
Okay.
Next one, what single dose of IV benzylpenicillin should be administered to a class 4 patient?
2.4 gram.
2.4 gram.
2.4 gram. Then next one, what may be impaired if anti-inflammatories are given to patients who take ACE inhibitors?
Renal function.
Renal function. Then 13, what is the single dose of oral glucosamine recommended for the least serious category of cellulitis?
500. 500.
So
500.
yeah, 500 is the answer. Then 14. What is the maximum single dose of IV clindamycin recommended for a patient with class 4 cellulitis?
1.2 gram.
1.2.
gram.
Then the 15th, it may be necessary to carry out dash blisters caused by cellulitis.
Proactive management.
Proactive management.
Proactive management. Proactive management.
That answer is not correct.
Aseptic
Should
aspiration.
be specialized advice.
Yeah, I will explain it in later. The answer is
Aseptic
aseptic aspiration. Then 16th, when prescribing anti-inflammatory, dash may be used as an alternative to ibuprofen.
Naproxen.
Yeah.
Naproxen.
Then the next one, a patient may have been exposed to infection by swimming in surface water or using
Hot tub.
Water.
yeah.
Water.
Then 18th one, conditions such as dash or even metastatic cancer may be mistaken for cellulitis. Litchi, could you please?
DVT.
Yeah. Then the next one is deep vein thrombosis or DVT. The abbreviation also given on the text, so you can write either DVT or deep vein thrombosis. The 19th one, patient with exacerbating cellulitis, a compromised immune system, and those with dash should be hospitalized.
Deteriorated.
Facial cellulitis.
Yeah, there is also 2-3 answer coming. So facial cellulitis is the correct answer. Then the 20th one, patients suffering from dash can experience repeated episodes of cellulitis.
Chronic
Chronic lymphedema.
Chronic lymphedema. Okay.
Lymphedema.
So you can just copy those who didn't get the
Chronic
answer. You can,
lymphedema.
yeah, chronic lymphedema. So those who didn't get the answer, you can just copy this answer option from the 1 to 7. So I mentioned here the answer. Question number 1C, 2D, 3B, 4A, 5D, 6C, 7D, and 8C. Then the 9th one, topical from the text D, and 10, morbid obesity, 11, 2.4, tall, renal function, 13, 500 mg, 14, 1.2 gram. Then 15, aseptic aspiration, 16, naproxen, 17, hot tubs, 18, deep vein thrombosis or DVT, and 19, facial cellulitis, and 20, chronic lymphedema. So here now we are going to discuss about each questions from each paragraph. So the fourth question, all of you got the answer for the fourth question because now I'm focusing on the text A. Anybody has doubt about fourth question?
Yes, Nimi.
Yes, ma'am. Me also, ma'am.
So what was the fourth question? Symptoms that may be experienced before infection visible. This was our question in the fourth one. So this one, here the keyword, symptom, the modal verb may, the before, it's coming before, something before experience the infection visible. Here, you can see the symptoms while we underline the keyword. The first paragraph, here, cellulitis is an acute bacterial infection, dermis subcutaneous. Then here is saying about some symptoms, painful and hot, tender. Here is the one keyword, sometimes. This is a time expression here. Then blister formation. So our question, what is about the before infection? The blister is formed before. Fever and nausea. See, did you see fever and nausea may accompany or perceive skin changes. So here the before, you see This is the synonym precede, come before. The skin changes. If there is infection, the skin changes will come there. So before the skin changes, the patient may have fever and nausea. These are the symptoms.
Yeah, that is correct.
Yeah.
Yes,
Is there any doubt about this question?
Yeah, that is again, that is correct. Yes, yes.
Yeah, so this one is no need to underline all the words. So here there is a one-time here they are saying about the acute onset of red, painful and all the symptoms. But here sometimes with the blister formation, fever and nausea may. So here also the may accompany or precede skin changes. Okay, next question from the text A, 17. So is there anyone has confusion about this question?
Ma'am, please explain 7th.
No, I will come there 7. So because now I'm focusing on the each text and the questions.
Yeah, 7.
I will explain 7. This is 17. I am asking. This is from the text A.
Yes, need explanation.
Do you,
please
no,
explain,
anyone has
ma'am.
doubt about this
17.
17 question?
Yes, ma'am, I have doubt.
No.
So
Yes,
here
ma'am,
the-
please.
Yeah, 17th question. A patient may have been exposed to infection by swimming in surface water or hot tubs using. Because here maybe you have doubt about the fresh water and here a salt water, then the hot water here. You can check here, it's exposed to infection, swimming in surface water. So the swimming, where we can either in the fresh water or salt water, we can swim. So this is the two to answer. These two come together here, swimming in surface water. Then here the keyword using. So here you can see the keyword use. So caused by use of hot tubs. So what we are writing? Exposed to infection by here the fresh water or swimming water or using hot tubs. Did you get the point?
Yes, ma'am.
Yes, ma'am. Yes.
Yes.
Okay.
Yes. Yeah.
So move to next one.
Ma'am, please once again.
Yeah, here which part is you got the doubt? Tell me.
The same question, 17th one.
No, what you didn't get? What was your answer?
Oh, I didn't get the answer. Sorry.
Oh, it's okay, fine, no problem. So here you see the question paper. Question. Patient may have been exposed. So exposed, we know it's exposed to infection.
Okay.
It's by swimming in surface water. So swimming. The
Okay.
swimming where they can do the swimming. Swimming by the fresh water they can do swimming. Caused by exposure to fresh water. So the next one caused by exposure to salt water. These two here, the exposed swimming, where we can do swimming, fresh water, we can expose the swimming by salt water. Then here we are going, here there is a one or keyword here using. See this keyword, where it's given the keyword. It's caused by use of hot tubs.
Okay.
This paragraph is about commonest organisms for the cellulitis. So here the names of the organisms, Streptococcus or Staphylococcus, all this one. Then the type how it's caused by. So it's a bracket they are giving. So here swimming, we can swim with the fresh water or salt water. There may be a chance to get an infection. Or using the hot tub. This is the word here, using, and here in the text, use hot tubs. Did you get?
Yes, ma'am. Thank you.
You're welcome. So next, the 20th question from the text A. Anybody have doubt about this one? Question number 20.
No, ma'am.
All got the answer?
Yes.
I did not get. Nimi, I did not get.
You didn't get. So the 21 patient suffering from dash can experience repeated episodes of cellulitis. So here the patient is suffering from something can. This is the modal verb and repeated episode. So here when we skim and scan the repeated episode, we can see recurrent cellulitis. So which means the synonyms used here, recurrent. It's also repeat. Recurrent cellulitis means a repeated cellulitis, repeated episode. So more common in people who have chronic lymphedema. So here patients suffering from chronic lymphedema can experience repeated episodes. Then the rest of the, especially in those with, so this is the people who have chronic lymphedema, especially in those with a history of venectomy or coronary. This one is no need here. So the question is coming only here. Recurrent episode, where is more common? More common in people who have chronic lymphedema. So this is the patient suffering from chronic lymphedema can experience, see, who have, can experience repeated episode, recurrent cellulitis. Did you get?
Yes.
So next we are moving to the text B. The questions from the text B. The question number 3. So now we are going to the text B. So I will explain all the questions from the text B. So here the question number 3 from the text B. Anybody have doubt about the question number 3?
Yes, ma'am.
So here
Yes,
a
ma'am.
system, this one, the question, what is the question? A system for determining where and how best to treat patients with the cellulitis. So the system may be, the treatment may be, some of you wrote the answer option C.
Yes,
Here
ma'am.
C.
We wrote it as
Yeah,
C.
that is confused. That's I told, and when we are underlining the keywords also, title, subheading, section heading, all this one we have to mark. So here, severity of cellulitis, title, then the section heading, the Emerson classification system can help to guide admission and treatment. So a system, what is the system here? Classification system, Aeron classification system. So how to
Yes,
best
got, ma'am.
treatment options. So the admission and treatment decisions. So this classification system, that's why the answer is under text B. Okay, then the 10th question. It's also from the text B. Which pre-existing weight-related condition would prompt a class 2 categorism? This one, I think all of you got the answer. It's there. This is class 2 categorism.
Yes, ma'am. Got it, ma'am.
It's directly go to the class 2 categorism. This is here the conditions. Well, but with a comorbidity, then there are examples. So here morbid obesity. This is, as we know, this is a weight-related condition. The rest, all other, it's not a weight-related condition. Okay. Then the question number 18. Conditions such as dash or even metastatic cancer may be mistaken for cellulitis.
Sorry to interrupt, ma'am.
Yeah, okay.
Ma'am, by this, like how we will go to which text? How can we locate, ma'am, by reading this 18? By reading this question, I was not able to locate to which text, first of all. Like,
see, the first, do you remember we do the skimming and scanning for the first one, 4 tests. Then what the, we have to look for the skimming, the title, subheading or model words, so there is negative expressions, number, abbreviations like that. So here see, so if we, here one abbreviation DVT. So we have to identify, we have to underline this DVT here. So if you didn't get that answer, no worry. Just skip that one, then move to the another question. So the once you finish, you check all 20 questions. So almost you read the all the text again. Then you can go back to again. While you are reading, you will memorize something you read in the text A or something, maybe in the comorbidity I read in the text B or somewhere else. So that's a practice with the skipping.
yes, I got it, ma'am. Like every time I have this problem, like in my mind, it is like A, definition, B, classification, C, treatment and management. So when I read the question, I don't know which text to locate the answer. So there I'm losing my time.
Yeah, don't lose your time. So this is now in your mind, that is the identification of the 4 test sequence. The first is definition, but the each test when you are, while you are reading, you can understand what is about this 4 texts. What is the relationship between these 4 texts? So here this text, the first one is definition, and second one was the severity, and third one the treatment, typical and atypical, and the fourth one was the management. So then you have to do the skim. That time, the important point you have to underline. Then doing the question, the keyword, then search for the, with your mind, you search there. And if you didn't get the answer, skip that one. Skipping is most important.
Okay, ma'am.
And what you have to do not rush to practice many materials. You try to practice one material for the same material for 1 week. In between, you can use the other material also, but you have to identify even the answer is correct also. Recheck again how this become correct, the answer. Then why the answer was wrong. So you do the self-analysis and find out where is your weakness and focus on that area more. Are you following me?
Yes, yes.
Yes, ma'am.
Yes,
Yeah,
ma'am.
yeah. Okay, then the 90th one, patient with exacerbating cellulitis, a compromised immune system, and those with the dash should be hospitalized. Everyone got the answer?
No,
So
Nimi.
here,
Rapidly deteriorating.
no. This one, in suspected case of patient with exacerbating cellulitis, suspected case of cellulitis, immediately hospitalize anyone with a class 3 or 4. In addition, anyone who is immunocompromised has facial cellulitis. So just check. Patients with exacerbating cellulitis, a compromised immune system. See here, immunocompromised. Then, and those with here, and see here, has facial cellulitis should be hospitalized. Here, see, must be hospitalized. So here the question, immunocompromised, a compromised immune system. Has, it's with, then has facial cellulitis. So read the keyword thoroughly, then check the answer. Maybe you go for here, must be rapid deteriorating, must be hospitalized.
Yes.
So this is the common, it's the coming from here. Rapidly deteriorate must be hospitalized. This condition, our question is this one, our keyword from the question. So answer to the question. Okay.
Okay, ma'am.
Then the text C. Text C has a two subheading. There is a treatment for a typical and a atypical. Then the sixth question. Anybody has doubt about sixth one? Alternative medication for cellulitis. Patients who cannot tolerate antibiotics. So here the penicillin. We can see if allergic to penicillin, use ciprofloxacin and clindamycin only. So this is the alternative medication for the antibiotic. Patient cannot tolerate penicillin. Then the eighth one, who should be consulted regarding pharmacotherapy? Maybe you have doubt about this question, pharmacotherapy. Someone said it's in the text D. Anybody have doubt now? Because before we are discussing, someone said it's from the text D.
Yes, ma'am, please.
Yeah, because this one is asking the question. Here the keyword is pharmacotherapy. The text D was management of locally affected area. That's saying about the. So here it's coming on the pharmacotherapy discussed with the local medical microbiology services. So because the question under the consulted discussed with the local medical microbiology services. So this is about Isha.
Yes, clear.
So this is a pharmacotherapy. That's why the other one specialist, it's not about the pharmacotherapy in the text D.
Yeah, correct.
Excuse me, ma'am.
Yes, see here, but it's conduct a proactive management of blistering, including aseptic aspiration. But if in a doubt, seek specialist advice. So here the blistering, conduct aseptic technique, and but here if you have doubt, seek specialist advice. But in our question, this one, it's about the pharmacotherapy. Pharmacotherapy falls under the drug therapy for a typical and atypical in the text C. Okay, someone called me. Did you clear the answer? Is it clear?
Yes, ma'am. Yes, miss. Clear.
So the it's
Yeah,
not
yeah,
about the
ma'am.
class 4. This
It's
is about the
ma'am.
alternative medication. Then the 13th one, it's also directly given. Anybody has doubt about this one? 500 mg. Then the 14th one, what is the maximum single dose of IV clindamycin recommended for a patient with the class 4 cellulitis? This is the 1.2 gram. It's here the maximum. So we have to write the gram also. Then the text C has the another one subheading also, suitable drug therapy for a typical cellulitis. This is from the question number 1. Treatment for cellulitis caused by less common bacteria. So the treatment, the suitable drug therapy for atypical. So this is the less common. That's why the text C, the answer. So shall we move to text D?
Yes, ma'am.
So here the question number 2. Anybody has doubt from the question number 2? Reason for drawing affected area. It's directly given. It's drawing. It's a marked with a pen here. So that's why the answer is text D. The 5th one, for ensuring that patients legs are more comfortable in bed. So here, elevate the affected limb and cause a bed cradle to avoid irritation or increased pain caused by contact with the sheet. That's why the text D. Then the 7th one, have to deal with the infection site after the swelling has begun to reduce. This is the management of locally affected area. This is the how to deal, the management. Then the 12th one, what may be impaired if anti-inflammatories are given to patients who take a AC inhibitor. Anybody have doubt about this one? This is also given directly. Then moving to 15, it may be necessary to carry out of dash blisters caused by cellulitis. I think someone asked this one before.
Yes, Nimi.
Yeah, this is the 15 one, aseptic aspiration. Someone said it's a proactive management. Maybe this one is confused about the proactive management and aseptic aspiration here. So here you can see the question. It may be necessary to carry out. So here the keyword, it may be, the modal verb may is there, necessary to carry out dash blisters caused by cellulitis. So here you can see conduct proactive management. So the conduct proactive management, it should be do, it must be do the conduct. It's a need to do something. So that's why it's written conduct. But here the modal verb, it may. So that's why here for the blistering, so including aseptic aspiration. So here one of the proactive management, aseptic aspiration. So here the question, what may, it may be necessary. So it's not sure, it's not must to do. It may be necessary to do aseptic aspiration. So here conduct proactive management, it must do the proactive management of blistering, but including, it's not must, it's necessary, it may be necessary to do aseptic aspiration. That's why the answer aseptic aspiration.
Yes, ma'am.
Yeah, so this one is before the answer, but if in doubt, seek specialist advice, because this is about the aseptic proactive management. If there is a doubt, ask for the specialist advice. Then the next one, when prescribing anti-inflammatories, that may be used as an alternative ibuprofen. This also directly given here. Use ibuprofen or naproxen. So here the some of the synonyms, less common, atypical, drawing, mark, deal with infection, management, pharmacotherapy. It's in the question. Not suitable, avoid, and comorbidity, pre-existing, has, with, and exacerbating, rapidly deteriorating. Then the next one, some of the paraphrased sentence, before the infection is visible, it's in the text, precede the skin changes. Then the next one, patients' legs are more comfortable in bed. So it's given, use bed cradle to avoid irritation or increased pain. Then the next, alternative medication in the question, if allergic to pencil in the text. Then may be imbibed, may pose particular risk. Then the next one, share the same symptoms as cellulitis or may be mistaken for cellulitis. So what you have to do while you are reading or listening anything, if there is a synonyms or paraphrase sentence, write it in a book. So it will be for help for your future reference. So if anybody needs to visit any slides, can I stop sharing?
This was well explained.
Nimi,
Nice.
answer
Yes.
key. Nimi, answer key.
Sorry, answer key.
Yeah, ma'am.
Yeah, this one.
Screen is not clear, but just not come to the center.
So I will say the answer. The 1C,
It's
second,
clear, ma'am.
clear.
No need to say it is clear. I have written
It's
already.
clear.
Okay.
But when it is not in the sender for me. I don't know. It's okay.
It's okay. So can I
no
stop
problem.
the sharing?
Yeah. It was well explained. Good.
Ma'am, can I ask a doubt? While writing the answer, should we write in small letter or capital letter, ma'am?
That doesn't matter. Either you can write in a capital letter or small letter, but it should be exactly copy paste and no spelling mistake. So if you are writing the small letter, make it clearly. So the examiner, they need to read your answer perfectly. All the letters.
I think sometimes we are not reaching on time.
So
Time only problem. Time.
that's the 15 minutes by practice. You can do it.
That's not worry.
Yeah. But do more practice with patience. And as I mentioned, that do the one material for a 1 week. So and thorough what are the things written there and make a synonyms or paraphrasing all the things. So you can defeat the time and aim for grade A.
Thank you, ma'am. It's very useful class.
Thank you. Good night.
Thank you, ma'am.
Okay,
Thank
Thank
you,
you,
ma'am.
Nice it was. Good.
Thank you, ma'am. Nice explanation.
Thank you, ma'am.
Thank you so
Thank
much.
you, ma'am. Very beneficial class.
Super, Nimi. Super class.
Thank you.
Thank you, Nimi.
Nice.
Thank you, Nimi.
Thank you.
നല്ല ക്ലാസ് ആയിരുന്നു.
Thank you, Nimi, for today's wonderful session.
Thank you, Arya.
അടിപൊളി ക്ലാസ് ആയിരുന്നു. നിമിയുടെ ക്ലാസ് അങ്ങ് ഇഷ്ടപ്പെട്ടിട്ട് ആൾക്കാര് പോകുന്നില്ലല്ലോ ഇറങ്ങി.
സുമിയുടെ സൂപ്പർ ക്ലാസ് ആയിരുന്നു കേട്ടോ. റീഡിംഗ് പാർട്ട് ഞാൻ യൂട്യൂബിലാണ് കണ്ടത്.
സുമി പറക്കുവാണ്. നിങ്ങളൊക്കെ ഭയങ്കര കോമ്പറ്റീഷൻ ആട്ടോ.
സുമി പറക്കുന്നുണ്ട്. ഞാൻ കണ്ടായിരുന്നു. സുമി പറക്കുന്നുണ്ട്.